Doctors warn you might be eating this vegetable that increases stroke risk fast. Imagine going to bed after what you think is a perfectly healthy dinner, salad, steamed veggies, maybe a cooked side of corn, and waking up in the middle of the night confused, with one arm weak or your speech slurred. That sudden, frightening moment is the picture behind this warning. The headline sounds sharp because the situation can be sudden, but the reality is nuanced. Certain vegetables that are healthy for many people can act differently in people over 60, especially depending on when you eat them, how much you eat, how they're prepared, and what medications you're taking. I'm a clinician speaking directly to seniors and the family members who care for them. My goal here is not to scare you away from vegetables, far from it. Vegetables remain a foundation of a healthy diet, but aging changes how your body handles food. Kidneys filter less efficiently, blood vessels become less flexible, hydration can be more fragile, and many older adults take medications that interact with natural compounds in plants. When those factors line up, late-night eating, medication interactions, reduced clearance, the result can sometimes be a faster onset increase in stroke risk for a vulnerable person. We'll walk through 9 common vegetables, from the one that's least likely to be a problem to the one that deserves the most caution, and for each, I'll explain the why and the exactly how to keep it on your plate safely. Before we start the countdown, a quick primer on why the same food behaves differently after 60. Think of your kidneys as household filters that slowly get a bit clogged with age. They don't remove certain compounds as fast as they used to. Blood vessels over decades can stiffen and narrow a little, so anything that changes blood thickness, blood pressure, or causes sudden constriction can have more impact. Hydration is another big one. Older adults are more likely to get quietly dehydrated overnight, and dehydration can make blood thicker and more likely to clot. Finally, many people over 60 are on medications, blood thinners, blood pressure pills, diuretics that interact with food chemistry. Put these elements together, and something that's harmless at noon may be riskier at bedtime. We'll count down from 9 to 1. For each vegetable, I'll say what people usually think of it as, explain the plausible mechanism for increased risk in older adults, and give practical steps you can take to keep enjoying it safely. Always remember, this is educational information. If you're on prescribed medicines or have kidney, heart, or clotting conditions, talk to your healthcare provider or pharmacist before changing your diet or your medications. 9. Spinach. Most people think of spinach as a nutrient powerhouse: iron, vitamins, fiber. The specific concern here is oxalates, plant compounds that can bind with calcium to form tiny crystals. In a younger person with strong kidney function, these crystals are often flushed out. In someone whose kidneys clear less efficiently, crystals can accumulate or contribute to stone formation. If crystals form, or if kidney clearance is slow, that can indirectly stress the system: pain, inflammation, and in some cases, changes in how minerals are balanced. For older adults who already have reduced kidney function, large late-night portions of raw spinach, think big salads right before bed, may increase the risk that your body has to work harder to clear those compounds overnight. How to keep eating spinach safely? Consider cooking it. Lightly steaming or sautéing reduces bulk and can change how oxalates behave. Eat your leafy greens earlier in the day rather than right before sleeping. Pair spinach with calcium-containing foods consistently rather than taking concentrated calcium or oxalate supplements on top of a spinach-heavy meal. And if you have known kidney disease or a history of calcium oxalate stones, discuss your spinach intake with your nephrologist or primary doctor. Clinical caution: if you're on medications that affect kidney function or on high-dose vitamin, mineral supplements, check with your provider. This is about combinations, not banning a vegetable. 8. Broccoli. Broccoli gets lauded for fiber, vitamin C, and antioxidant compounds. There's one nutrient in broccoli that matters especially for people on certain blood thinners: vitamin K. Warfarin and a few other older anticoagulants work by altering how vitamin K is used in the body, and having big swings in vitamin K intake can change how those medicines act. The issue isn't eating broccoli once, it's sudden inconsistency. eating a large helping one day and none the next, which can make maintaining the right balance on drugs like warfarin harder. How to handle broccoli safely. Be consistent. If you usually have a cup or two a week, keep that pattern so your clinician can manage your medication plan around it. Prefer cooked over raw if you're worried. Cooking can change the concentration and absorption of some nutrients. If you've recently been prescribed or had your anticoagulant changed, tell the prescriber about your vegetable habits. For people on newer direct oral anticoagulants, DACs, vitamin K interactions are less of a concern, but always verify with a pharmacist. Don't stop or change your anticoagulant on your own. Instead, bring a food list to your next appointment so your medical team can advise. 7. Romaine lettuce. Lettuce usually reads as the ultimate light, hydrating food, but romaine has mild natural diuretic effects in some people, meaning it can increase urine output slightly. For a healthy, well-hydrated adult, that's usually harmless. For an older person who eats a large romaine-heavy salad late at night or who is on diuretics for blood pressure or heart failure, the combined effect might lead to overnight dehydration. Dehydration thickens blood a bit, which can increase the chance of clotting in someone already prone to thrombosis. Practical steps: don't make a giant late-night romaine-only salad your routine. Spread leafy meals earlier in the day. Drink a glass of water with dinner and another before bed if your doctor says that's okay. And if you're taking diuretics, coordinate timing. Ask your clinician where best to schedule your medication and higher potassium or diuretic foods. If you or your caregiver notices less urine output, dizziness, or concentrated urine, alert your provider. A few extra greens are almost always fine. It's the timing and the combination with medicines that matter. 6. Raw carrots. Carrots are celebrated for beta-carotene and fiber. The wrinkle for older adults isn't the beta-carotene itself, but how raw, starchy vegetables can cause a fairly quick release of sugars into the bloodstream in some meal contexts, especially when eaten alone at night. A rapid rise in blood glucose can trigger stress hormones like adrenaline and cortisol, which in turn can tighten blood vessels and temporarily raise blood pressure. In someone with brittle glucose control or vulnerable vessels, that overnight spike and subsequent crash and the vascular constriction that comes with it could contribute to an acute event. How to eat carrots more safely: cook them or pair them with protein or healthy fat to slow sugar release. Think chicken and a side of cooked carrots rather than a plate of raw carrots alone at 10 p.m. Avoid large portions of starchy vegetables as a late-night snack if you have diabetes or prediabetes. If you take insulin or medications that lower blood sugar, coordinate the timing of food and medication with your clinic so you don't get unexpected swings overnight. 5. Garlic. Garlic is prized for its flavor and for compounds that have mild blood-thinning effects. That's why doctors sometimes talk about garlic's cardiovascular benefits. The same compounds that make garlic anti-clotting can add to the effects of prescription anticoagulants or antiplatelet drugs. For an older adult taking warfarin, aspirin, clopidogrel, or the newer anticoagulants, regular high intake of raw garlic or high-dose garlic supplements could increase bleeding risk or make it harder to predict how those drugs behave. Safe approaches: enjoy garlic cooked in food rather than popping raw cloves every night. Avoid concentrated garlic supplements unless your clinician approves them. If you're on any blood-thinning medication, let your pharmacist know about your garlic habit so they can help monitor bleeding risk and coordinate follow-up. If you notice unexplained bruising, dark or bloody stools, or nosebleeds, contact your health provider. Don't assume these are just normal. 4. Onions. Onions are a kitchen staple and have compounds like quercetin that can modestly lower blood pressure in some people. For most, that's healthy. But when combined with prescription blood pressure medications, especially multiple drugs used together, onions might contribute to blood pressure dipping too low, especially in someone who's already sensitive or takes medication modifications. Symptoms of low blood pressure: dizziness, lightheadedness when standing, can lead to falls, which is another serious risk in older adults. How to manage onions. Keep portion sizes moderate and avoid late-night onion-heavy meals if you're prone to lightheadedness. If you take 2 or more blood pressure medicines or you've had lightheaded episodes, ask your clinician whether your diet could be a factor. Cooking onions tends to mellow their active compounds. If you enjoy raw onions, be mindful of timing and pairing. And don't start any onion extract or high-dose supplement without medical clearance. 3. Corn. Corn is often thought of as a simple, wholesome side, especially canned or frozen varieties. Nutritionally, it's fine for many people, but corn behaves more like a starchy carbohydrate than a leafy green. When eaten in large amounts, especially late in the evening or as a processed form like creamed corn, it can raise blood glucose levels relatively quickly. For older adults with impaired glucose tolerance, that can provoke glucose swings overnight, and those swings can cause transient increases in blood pressure and stress hormones, potentially stressing fragile blood vessels. How to eat corn safely. Prefer smaller portions, pair it with protein and fat to slow absorption, for example, a modest serving with grilled fish and olive oil, and avoid heavy amounts right before bed. If you have diabetes, monitor your blood sugars and plan starchy foods at times when you're more active. If you take medications that manage blood sugar, coordinate with your clinician before changing timing or portion sizes. 2. Asparagus. Asparagus has a reputation as a springtime elegant vegetable with vitamins and fiber. Like romaine, asparagus can have a mild diuretic effect in some people, increasing urine output. In older adults, especially those on diuretics or who drink less fluid, that can contribute to overnight dehydration. Again, the risk is thicker blood and a higher chance of clot formation in susceptible individuals. There's another practical aspect. Asparagus can change how your urine smells and sometimes urges you to urinate more, which can disturb sleep and change nighttime hydration patterns. How to keep asparagus on the menu. Eat it earlier in the evening rather than right before bed. Stay hydrated during the day, and if you are on diuretics or other medications that affect fluid balance, coordinate timing with your clinician. If you're a caregiver, watch for changes in nighttime bathroom visits or for signs of clotting or dizziness in the morning. 1. Tomatoes. Tomatoes are everywhere. Sauces, salads, snacks. They're rich in lycopene and vitamins and are generally heart healthy. For the purposes of this countdown, tomatoes sit at number 1 because of a combination of factors. They contain a variety of bioactive compounds. Some people are sensitive to histamine-like substances or tyramine-related molecules. They're acidic, which can influence stomach and electrolyte balance in certain conditions. And their popularity means many people eat them late and in large quantities. Think tomato sauce as a late supper. In vulnerable older adults, those elements together, sensitivity to certain amines, acid-related shifts, and the potential for electrolyte changes, especially in someone on diuretics, could contribute to sudden symptoms like palpitations, blood pressure changes, or nervous system effects that, in rare cases, might precipitate an acute vascular event. How to eat tomatoes safely? Avoid very large, late-night tomato-heavy meals if you have known sensitivities, are on multiple diuretics, or have fragile cardiovascular control. Cooked tomato products can concentrate certain compounds. So, if you're on medications that affect electrolytes or blood pressure, be careful with very large servings of tomato sauce at night. Pair tomatoes with protein and fat. Spread tomato-based meals earlier in the day. And if you notice heart palpitations, lightheadedness, or unusual neurological symptoms after tomato-rich meals, seek medical attention and bring a record of your diet to your appointment. A few cross-cutting truths to keep in mind as you listen to each of these items. First, timing matters. Eating a big plate of starchy or diuretic-rich vegetables right before bed, when kidneys slow down and you may be less hydrated, changes the equation. Second, pairing matters. Protein and healthy fat slow the speed at which sugars hit your blood and blunt sudden metabolic shifts. They can also reduce the concentration of active plant compounds in the digestive tract. Third, consistency matters, especially for vegetables with vitamin K or with compounds that affect clotting. If your diet swings wildly, your medication management may need to change. Steady intake is easier to manage than spikes and drops. And finally, always consult your healthcare team before changing how you take your medication, before starting supplements, or before making dramatic dietary changes. Quick mid-video recap. 3 simple rules to remember. Eat those potentially risky vegetables earlier in the day. Pair them with protein or fat rather than eating them alone at night. And talk with your healthcare provider or pharmacist about how your diet and medications interact. If you're finding this helpful, please tap the like button so other seniors and caregivers can find these tips. That's the only quick request I'll make in the middle of this video. A few practical household strategies for seniors and caregivers beyond the specific food advice. Keep a simple food log for a week and bring it to your clinic appointment. Write down what you eat and when, and note any symptoms like dizziness, unusual bruising, palpitations, or nighttime awakening. If someone you care for takes blood thinners or multiple blood pressure meds, ask the pharmacist for a medication food review. Pharmacists are excellent at spotting interactions. Avoid starting any concentrated herb or vegetable supplement like garlic extract or concentrated vitamin K pills without explicit approval from your clinician. Small, consistent changes are safer than overnight overhauls. I'll add one clinical anecdote, but remember, this is an illustration, not universal proof. In practice, I once followed an older patient who regularly ate large late-night salads with raw spinach, garlic, and a tomato-based dressing. He was on warfarin and a diuretic. Over a few weeks, he had increased bruising and a brief episode of lightheadedness on Spanding. When we adjusted the scheduling of his medications, asked him to shift the big salad to lunchtime and to cook some of the greens, and involved his pharmacist to monitor anticoagulation more closely, those problems diminished. That story underscores the larger point. Food and medications interact, but thoughtful coordination usually allows people to keep eating the foods they love. A few more hands-on tips. If you're going to enjoy a salad, have it with lean protein and a healthy fat. Grilled salmon and olive oil help slow digestion. If you like broccoli or other vitamin K-rich greens and you're on warfarin, pick a routine. Same rough portion on most days, and tell your clinic about it so they can manage your medication plan. When in doubt about supplements or concentrated extracts, say no until you've checked with your doctor or pharmacist. If you're the caregiver, offer water with dinner and encourage a short walk after meals to help regulate blood sugar. And if you have kidney disease, avoid sudden, large helpings of oxalate-rich foods without a nephrology consult. As we wrap up, let me be clear. These vegetables are not enemies. For most older adults, they are part of a healthy, balanced diet. The issue we're discussing is a small subset of situations where timing, quantity, preparation, and medication combinations can increase vulnerability. Awareness is the tool that gives you freedom, so you can keep vegetables on the table without unnecessary risk. Medical disclaimer: this video is for educational purposes only. It does not replace individualized medical advice. Do not stop or change prescribed medications without speaking to your healthcare provider or pharmacist. If you have concerns about your diet, medications, kidney function, blood pressure, or clotting risk, make an appointment with your clinician and bring a list of the foods and supplements you take regularly. If one of these vegetables surprised you, tell us in the comments which one and why. Your experience might help a neighbor or caregiver. Share this video with someone who helps care for a parent or grandparent. If you want more practical guides for senior nutrition and medication safety, subscribe and tap the notification bell so you don't miss future episodes. Above all, work with your healthcare team. Small conversations about your plate can make a big difference in keeping you safe and independent. Thank you for listening carefully. Remember, eat wisely, time your meals, pair foods thoughtfully, stay hydrated, and coordinate with professionals. With those steps, vegetables can stay a delicious, healthful part of life well into your later years.